Okay, so this is the room that I'm gonna use for my health assessment test. Okay. Okay, so today I'm gonna do a circulatory assessment, and before I start, I need to gather the materials that I need, which is my stethoscope, an alcohol swab, and a Johnny shirt for my patient. And when I enter a room, I'll do hand hygiene and I'll introduce myself. My name is Gladys. I will be your nurse today, and I'm gonna do a circulatory assessment. And it has two parts. It's I'm gonna ask question first, and the second part is I'm gonna do the test. Can I get your name
Noel,
and your birth of date?
9, November 18, 1988.
Okay, thank you. So I'll start asking question. Do you feel any chest pain?
Yes.
That does it get worse when you move your arms
Yes.
and your neck?
Yes.
Okay. Do you have cough?
Yes.
Is it wet or dry?
Dry.
Do you have any history of hypertension?
Yes.
How about elevated cholesterol?
Yes.
Do you experience heart attack or heart problem before?
No.
No. Okay. What is your usual diet
Just eating rice and meat.
and meat? Okay. And do you work out? Do you exercise?
No.
No. How about smoking? Do you smoke?
No.
Okay, thank you. And now I'm starting doing the test, and I'll start with auscultating the carotid artery. So I need you to see, yes, see properly there. And I'll start, and I'll using the bell of my stethoscope. Listen. So I'll first listen to the one in the angle of the jaw. And to the center of the neck, and to the base of the neck, then I'll also do it on the other side. History. And to the center of the neck. And to the base of the neck. So I auscultate the carotid artery to check if there's bruit on it, but his sounds good. It doesn't have bruit on it. So now I'm gonna palpate your carotid artery. Then I'll do the other side. So I'm palpating it and I'm checking for the rate and the rhythm, and it's normal. And I also checking if it's symmetrical to each other, if it's the same, and it is the same, so it's good. And I can't do it both on the same time because it will going to like when I press it, it will going to have effect on the circulation of the blood going to the brain. So I'm not gonna do that. So now I need you to lay down on the bed. So now I'm gonna check the jugular vein of my patient. So I'm just visualizing it. I'm seeing some vein in there. Can you look on that side? And how about on this side? Okay, so I'm visualizing it and I'm seeing some vein on it in there, but it's not really bulging and it's not pulsating, so it's good. Now I'm checking the chest area and trying to look at the apical pulse, but I'm not seeing it, so I'll just do and I'll just palpate it. So now I'm gonna palpate the apical pulse. So this is the mid-apical line, and here is the apical pulse. So the rate and the rhythm is normal. So I'll now do palpation on the pericardium area. I'm looking for some tenderness but there's none, so it's good. So you can now sit. You can go back to your chair. Now I'm going to do is I'm gonna auscultate. I'm gonna listen to his heart. So I'll do it first with the diaphragm of my stethoscope. So I'll start listening to the aortic valve. And now I'll move to the pulmonic. I'm now here in the laptop. So I'll now moving to the herbs point. And to the tricuspid. And to the Mistral. Okay, so now I'm gonna use the bell of my stethoscope. I'll start again with the aortic. Then the pulmonic. Then to the herbs point. And the tricuspid. And to the Mistral. Okay, so while auscultating it, I'm listening to the heart sounds, the S1 and the S2. And the S1 is louder on the Mistral part of the heart, and the or the apical pulse. And it is and then the S2, it is louder on the base of the heart, will is the pulmonic. So I'm also listening to abnormal sounds of the heart, and I don't hear any on his heart. Like there's no whooshing sounds, there's no murmurs, or there's no click sounds in his heart. So it's good. But if ever I'll encounter or I hear sounds, I have to ask my patient if someone already tell him that they heard a murmur sound in his heart, and I'll document it, what part or what is the location of that sound when I listen to it, and I'll have to um, communicate it or tell it to the healthcare providers. Okay, so that is the do you have any question? That will be the end of my circulatory assessment to you. Do you have any question?
No.
No, thank you. So that is the end of the circulatory assessment. Okay, thank you.